So I'm doing the cardio pulm patient. Once I introduce myself and kind of show or tell him what I'm going to be doing and take his vitals and stuff, we're going to start with a 30-second chair raise. We're doing this because he says he has trouble getting up from his chair, and so I kind of want to assess if he is able to do it and to see how many he can do in the 30 seconds. I think that this will be a good measure because even if he starts off with 0, then we can say that as he progresses through therapy, he's able to get to so and so number. And so it'll be a good assessment of his lower extremity strength. And the second test I want to do is the 2-minute walk test, and I want to do that because his caregiver stated that she notices that he gets tired and out of breath after a couple of minutes, and so what the plan is to kind of start with the 2-minute walk test. This will be a test to see what his endurance and functional mobility is, and so we want to assess him to be able to see where he is now, and then we want to see what he can improve throughout the course of therapy. And this is important because, well, he wants to go back to work, and so in order to go back to work, he's probably going to have to ambulate from his chair to the bathroom to the kitchen, from his office to the car, and all that kind of stuff. So it's a good assessment to see where he is, and if he improves, if this is not too difficult for him, we can always move up and do the 6-minute walk test next time. But again, this will also be a good indication to see what his gait speed and distance is. Hi Rocco, my name is Stacy. I'm the physical therapist that's going to be working with you today. How are you?
I'm doing well, thanks. How are you?
I'm great, thanks. So for today, we're just going to do an evaluation. I just basically get to evaluate you and see how you are moving around currently, and see what I can do for you, okay?
Okay.
So what we're going to do, just to kind of give you an idea of the plan for today, I'm going to start by taking your vitals, and then from there we will go do some testing. So one of the tests, you'll just stand up and down from the chair as many times as you can, and then the next test I'll just have you walking for a little bit, okay?
Sounds good.
So all of that is okay with you?
Yes.
Okay. And so another thing too is, have you ever seen one of these before?
No.
Okay, so this is a gait belt. A lot of physical therapists use this. We just put this around your waist to make sure that we are in control just in case, something happens, and that your safety is our first priority. So when it comes to it, before we stand up, is that okay if I put this on you?
Yes.
Okay. So again, we're going to start with your vitals. Okay. So, if you don't mind, I'm going to put this on your right hand, or finger, sorry. And then this one's just going to go on your left arm, okay? Make sure you're sitting normal. Just going to roll this up. Okay. All right. Is it okay if I take your watch off real quick?
Yes.
Okay. Thanks. So, I'm just going to take your hand and just go ahead and relax for a little bit, okay? Okay, so I felt your pulse at 120. Okay, so your oxygen is 95%. So what I'm going to be doing is I'm just going to gently place your arm on your stomach. We'll just hold this here for a couple minutes. While we hold this here, just think of some awesome stories you want to tell me later today, okay? Throughout our session. You can go ahead and relax. So the patient's pulse rate was 57. Their breathing rate was 20 breaths per minute. Okay. So keep thinking of those stories while I'm taking your blood pressure. I want you to come up with at least 5 good stories in your lifetime. All right, so I got 124 over 64. Considering that your blood pressure is usually normally high, I think that's wonderful at that level. So we'll take this off from you. Now are you ready to get started on some testing?
Yes.
Awesome. Okay, so we're just gonna put this gate belt on you first real quick, just to be safe. So just as a warning, this is gonna feel really tight while you're sitting, but once you stand up, it's gonna loosen up a little bit. How's that feel so far?
Not bad.
Is it pretty tight?
Not really.
Not really?
It's still pretty loose.
Okay. Can you breathe?
Yes.
Okay, so this is the first test. What we're gonna do is you're gonna stay sitting for now, and when I say go, you're just gonna stand up and sit down as many times as you can until I say stop. So you're gonna keep your arms across your chest like this, and if you really need to, then you can use your arms, but let's try not to use your arms, okay? So that's the goal. And so we'll do this for about 30 seconds, okay?
Okay.
Okay, and I'll just be right here just in case. All right, 3, 2, 1, go. Good. 1, 2, 3. Good. Keep going. You got it. 4, 5, and okay. So the next test, what we're gonna do is we're actually just gonna walk down the back. So I have measured out 12 feet. So what we're gonna do is I'm just gonna stand by your side as you need it. I will be here, and we're gonna walk to that shoe over there, and you're gonna turn around. Make sure you walk around it. Turn around, come back, and then turn around the shoe, and then keep going until I say so. Okay?
Okay.
All right. You ready?
Yeah.
And start. How are you feeling?
Not too bad so far.
Good. So let me know if you do, start to feel a little dizzy or really out of breath, okay?
Okay.
Oh, so that's okay. You're doing great.
Thank you.
So far it's been 1 minute.
We're halfway done.
Yep. How's your breathing so far? How are you feeling so far?
A little dizzy and a little out of breath.
Okay, let's go ahead and have a seat, okay?
Okay.
Okay, so that's it for today. So what I'm thinking is that we will continue therapy. I think there are some wonderful things I could do for you. I think that we could work on your leg strength to kind of help you with your what you were saying you're having problems standing up and getting down. So if we continue to work on that, then hopefully that will become easier for you. Also, I can help you with improving your endurance, which will be wonderful for your heart and lungs, and also be very good for diabetes and all the complications that comes with it. So I think what we'll do is we'll start with doing therapy twice a week for at least 4 weeks. And then in between those therapies, I'll just give you some home exercises to do while I'm not here. And we'll start off slow to make sure that your body will be able to tolerate it appropriately, and then we'll gradually increase. And hopefully, um, in those next 4 weeks, we can see improvement, and we'll retest again and just keep moving up from there until you're where you are or where you want to be, okay?
Sounds good. Thank you.
So as far as his sit to stand values, he did 5. And so we really want to get him up to at least 17, because that seems to be the normative values according to Shirley Ryan, for older adults his age. And so in order for him to be really a community dweller, 17 is kind of the average. So if we can at least improve up to, like, maybe make it a goal to at least improve from 5 to at least 12 before we end our visits, that would be wonderful, because then we can just send him to outpatient and hopefully continue to improve if he needs to. And as far as the 2-minute walk test, he got, let's see, so after he ended, I measured and it was about 6 feet. So he went around 6 times and then he did 6 feet. The length was 12 feet, so he got up to 45 meters. And so that's a little low for his age. According again to Shirley Ryan Lab, that we want him in his age range. A healthy adult should be about 183 meters. So we definitely want to improve that, maybe get it up to at least 100 meters. And before we discharge him. So because the goal is to increase their lower extremity strength, I was thinking that one of my favorite exercises to do to kind of help that would be useful for what he wants to get to is getting up from the chair, is to start with mini squats. So we could have him kind of standing on, like, next to a chair, a sturdy chair, a countertop, and just kind of have him lower. So he can start by just kind of lowering a little bit and then popping back up with holding on for steadiness. And so he'll just kind of go down and then back up, and making sure that we're working on bending at the hips and not using the arms to push up from the seat. And so one way to make that harder is to either take away the arms and just have him do it with his arms across his chest, or we can even have him go even further down, and have a chair behind him and touch the chair with his bottom. If that's too hard, then we can just have him go not as low. Maybe we can even have him just working on leaning forward and bending at the hips, kind of sticking the bottom out. Or we can just have him put more pressure onto a countertop, or if he has a walker, we'll kind of just put a walker, something sturdy for him to kind of use his arm strength to help him. So we want to start with 2 sets of 8, just to kind of, again, keep it easy so he doesn't get too scared off by our first visit of physical therapy, and then gradually increase the sets and the reps as it becomes really easy. The next thing that we can do is just have him walking around the house. So practicing walking and increasing his endurance. So I think the best way to do that is to do this for at least 15 to 20 minutes. And this could be even a good warm up for before therapy. Just have him walking around for 15 minutes with whatever rest breaks he needs. So he'll walk for 5 minutes or so until he gets a little bit too tired to continue. Give him like a minute rest break, but then continue walking right after that rest break. And for another couple minutes or so, give him another minute or two rest break, and then continue walking. So we could do that using the chair, have him do a couple laps back and forth, sit down, get up, do a couple laps back and forth, just like we did with the 2-minute walk test. And then I think that both of these would be good to do because they are very functional for what he wants to improve, as well as these will also help improve the functional outcome scores that we use. And in order to really measure how much he's working is we can keep measuring his vitals because he has a lot of the cardiopulmonary problems, that it's very important to make sure that his heart rate doesn't increase too much. So his heart rate was at the initial visit 124, I think, but to not let it increase. Definitely not past 160. But then also to monitor his oxygen. We don't want that getting below 90, and then his heart rate, make sure it doesn't get too high. But if we don't want to do that continuously, the best way I think that we could do is using an RPE scale and explaining how to use that with him, so that he knows where he needs to be in terms of therapy. One thing I forgot to mention as far as progressing and regressing with the intervention is with walking. We can just increase the rest breaks if it is too difficult, or we can decrease the amount of time that we're doing it for. So if the first time we do it, it's 15 minutes and he's just basically resting the last 10 minutes, then instead of doing 15 minutes, just do the 5-minute, or do it for like 8 minutes. But before he gets too tired, just kind of make sure he takes that minute rest break. And then continue increasing this by taking more like 30-second rest breaks in between instead of like a 1-minute rest break, and taking less rest breaks in between, as well as increasing from 15 to 25 minutes, 15 to 20 minutes, 20 to 25, and then if time allows it during the visit, maybe improve to 30 minutes, and see how that goes.